Well, hello, everyone. Welcome back to another episode of HeartBrief, your quick view of some of the most important studies of the past week. I'm Joel Kahn, medical doctor, board certified cardiologist with a focus on prevention. Let's get right to it because we have some super interesting studies. So, we are going to pick to look at right now a study published in Cardiovascular Diabetology within the last 2 weeks or less. Planetary health diet and other plant-based diets and the risk of type 2 diabetes, a prospective study from the UK Biobank. This was a large database where they did dietary histories back 2009 through 2012, and 112,000 people that were free of cardiovascular disease. They followed them for approximately 9 years, and they were able to grade their diet as to the health of their diet and how much of their diet was plant-based, and HPBD, healthy plant-based diet, was going to be the focus of the evaluation. Over time, these 112,000 people developed almost 3,000 cases of type 2 diabetes that were not present at the beginning. And when they compared those who were the most adherent to the Planetary Health Diet Index, one way of judging a plant-based diet, they found that diabetes risk was reduced by 43%. Those that followed other versions, a Mediterranean diet with a plant-forward focus or the DASH diet, similarly had about a 40% reduction in developing over 9 years type 2 diabetes. They concluded in this large cohort of British adults, higher adherence to a Planetary Health Diet Index was associated with a substantially lower risk of type 2 diabetes, which is a message that we've seen over and over. For example, the Adventist health studies. A 40% reduction in the risk of developing type 2 diabetes over 9 years is certainly significant. I think you agree. All right, let's go to a journal, Nutrients, within the last couple of weeks. Association of skipping breakfast with the metabolic syndrome and its components, a systematic review and meta-analysis of observational studies. Bowen Yang is the first author. And this was indeed a review with 9 studies identified to be of good quality. The results were pooled to provide sizable numbers, and the impact of skipping breakfast on developing the metabolic syndrome, the high triglycerides, low HDL, big waistline, high blood pressure, high cholesterol, and the rest, was identified in this example and cohort. And what they found was skipping breakfast did increase the risk of developing metabolic syndrome overall, the full definition, by 10%, and its components sometimes even more. The abdominal obesity went up by 17% if you skip breakfast. Hypertension went up by 21% if you skip breakfast. Cholesterol disorders, 13%, and high blood sugar, 26%. And given the fact that metabolic syndrome on its own carries a risk of progressive and lethal cardiovascular disease, non-alcoholic fatty liver disease, anything we can do to lower the risk of metabolic syndrome would be important. So we have to add the fact that skipping breakfast, which has been shown in other studies to actually also raise the risk of cardiovascular disease and cardiovascular events. So let's go to the third and final article, a very important article accepted into Alzheimer's and Dementia Journal and published within the last couple of weeks. Got a lot of headlines. You should know about it because it's such a common clinical issue with patients. Cholesterol-lowering drug targets reduce the risk of dementia. A Mendelian randomization and meta-analysis of 1 million individuals. Liv Tyborg Nordegård is the first author. And what they did, they had a database with the genetic data of over 1 million individuals that was coming, in this case, out of UK and other parts of the European continent. And they were able to identify certain single nucleotide polymorphisms, or SNPs. They were associated with lifelong low cholesterol, the kind of cholesterol we try and get people to using prescription medication like statins. They then looked over time at the risk of dementia and dementia of any kind. And what they found was that there was a dramatically lower, 80% lower risk of developing dementia during life when one was gifted with the genetics that keeps cholesterol lower than average. They then went on to discuss that if you were to achieve these same low cholesterol levels early in life and sustained in life through exercise, through diet, probably a whole food plant-based diet or some variation of that, like the portfolio diet, you would achieve such results. And even as they discussed with prescription medications, if indicated, could lower the risk. So this very large study joins at least half a dozen others in the last few years, indicating that actually cholesterol lowering medication is associated with a reduced risk of dementia. I know in my clinic and in my life on social media, you hear the opposite over and over, that statins like rosuvastatin and atorvastatin cause dementia. Well, the reality is they may cause brain fog, and when you stop the drug, the brain fog goes away. But the association with actual dementia is simply not seen. And in fact, in most cases, the reduction has been seen over and over in different databases. So I thought these were three very interesting studies. And the risk of metabolic syndrome with skipping breakfast, such a simple step. I teach my patients not to skip breakfast. The data on dementia and the other materials we talked about. So thank you for joining me at HeartBrief. We'll bring you more interesting and relevant studies for you and your practice in the coming weeks. Thank you.